everybody, Dr. Sadi Erfani, plastic surgeon with Spirit Lift Aesthetic Plastic Surgery, here to share with you some information today about breast augmentation. I think breast augmentation is one of the most popular procedures in the United States, if not the world, because of a very specific reason. It gives tremendous elevation of the self-esteem to the women who like to participate in this particular procedure. Here at Spirit Lift, we have 2 to 3 different methods that we like to employ for doing our breast augmentation. Of course, we use the implant augmentations, either using silicone or saline, and we've also introduced fat grafting now, which is a wonderful procedure for certain individualized patients who are seeking a natural type of breast augmentation using their own tissue. We're going to show you some pictures and videos of a breast augmentation. Some of our clients who experienced some wonderful results, and needless to say, they were extremely satisfied with their results as well because of the wonderful elevation of the self-esteem they were able to experience from it. So please sit back and enjoy, and as always, we're open to your questions and are awaiting you. Thank you.
So let's talk a little bit about breast augmentation. There are numerous opportunities and approaches for doing breast augmentation. The most recognizable, of course, are implant breast augmentation with silicone or saline implants placed either behind the breast or behind the muscle. And there is mastopexy, which is a breast lift utilizing the native tissue of the breast, and then you can also augment breast tissue with your own fat or autologous fat transfer. And the first thing we're going to show you is a schematic of a normal breast with the milk ducts and nipple areolar complex right here, and the breast tissue is right here. We see the fat surrounding the breast, and of course the pectoralis major muscle, which can be used and elevated to place an implant behind it, which is highly advantageous for preventing capsular contracture, which can be a very serious problem that can ruin a perfect result on a breast augmentation patient. And that's why my favorite location for placing a breast implant, either silicone or saline, especially saline, would be to place it behind this muscle here. The approaches that we use commonly could be a periareolar incision, which is an incision made in the inferior part of the nipple complex, and through that incision we can approach and tunnel down to the chest wall, where we can place the implant again behind the breast tissue itself, which is one option, or behind the muscle. The other option for incision is an inframammary incision, which is designed right under the junction of the breast with the chest wall, and through this we can approach and place the implant again in this space right behind the breast tissue or behind the muscle tissue, as previously stated. In order to show you again the muscle more distinctly, it is this number 2 arrow as well that you see right here, but also this purple arrow is demonstrating the pectoralis major muscle. And when you hear about submuscular implant placement, this is the muscle that's elevated with the implant placed behind it, and this is more advantageous, and this is my favored or preferred method of implant placement. And the second one would be the subglandular implant placement. Now this implant placement can look very natural. However, if you're using a silicone, or excuse me, if you're using a saline implant and you place it in this plane above the muscle, then there's a problem sometimes with implant visibility and rippling, which can be avoided if it's simply placed behind the muscle. And now we have the privilege of showing you a couple patients that we've done here at Spirit Lift. This young woman here had complaints of having small breast tissue, as well as having some drooping, or what is called ptosis of the breast. She opted to have a periareolar incision done right here under the nipple and an implant placed behind the muscle. And you can see the beautiful result and the projection obtained after a few months. The projection of the upper chest wall and the volume of the breast is now significantly improved. And of course, since it's behind the muscle, we've minimized the potential problem of a capsular contracture. Our next patient similarly had a complaint of having not enough breast tissue and projection of her upper chest wall here, and she also opted for a silicone implant placement done through a periareolar incision and placed behind the muscle as well. You can see with her as well that the implant was high profile and was able to give much more chest projection, which for her, she was seeking to have more filling out of her bikini, and she was able to succeed with this. And we see a frontal view of her as well. This is preoperatively, and then postoperatively we can see that the incisions are healing very, very well, and the fullness in the medial chest wall is visible, and clearly the projection, as we had seen in the previous photograph, has been much improved as well. And we thank these patients for allowing us to use their photographs to demonstrate these results.
Is this something that can help you or maybe someone you know? Come and see us for your free evaluation. We can't wait to wow you.